Hi, I'm Jason Birchem. I'm an RN in the emergency room here at Delta County Memorial Hospital. I've been here for almost 3 years. I've been in healthcare now going on 16 years, so longer than I care to admit. Well, first of all, they needed help. I've been in the ER here, and I've done a few other stints of a year or two in the ER, but a lot of my experience is in ICUs, higher level cardiac ICUs, CV ICUs. I was at White Plains Hospital, which is in White Plains, New York. I was in the cardiac ICU. When the COVID hit, they amped up the whole hospital, because before that it was 275, I think, med-surg beds and 24 ICU beds. At their peak, they were close to 500 med-surg beds, and they had 140 ICU beds. It was about a 10 to 15 minute process just getting garbed up. You would get your surgical booties on that would come all the way up to your knees. You would get a yellow gown, similar to the ones we have here, and then your first set of gloves. You had your N95. You then put on a PAPR, and then you put on the bigger blue surgical gown that went around that. And then you put on your second set of gloves. So if they got dirty, you took them off in the room. You actually had another pair of gloves underneath. So, and then once you were in, you got report, you did your patient care. They would come and just post a deal on the outside window, because there was going to be 8 to 10, 12 nurses in there, depending on if they're 2 patients to 1 nurse, or if you were running CVVD, CRRT, anything like that. They tried to do that 1-to-1. So they would just post that with when, here's where you're going to lunch. So as you came out, you went through a decontamination room. You would just go out, kind of stand with your arms out. People would come by, mist you, wipe the initial part off. The blue gown would come off, your first set of gloves. Then they wiped down the PAPR. All of that came off. They put a sticky that said Jason on it, and then it went to a blue light room where it was ultraviolet. So that took 20 minutes. You couldn't come back because your PAPR wouldn't be ready. And then they'd mist you again, then your yellow, your gloves, surgical booties, then you could leave, wash your hands, and go to lunch. Oh yeah, the first day of walking into it is a real eye-opener. It's like, what did I get myself into? Because you go in, there's just a big room with 16 patients and nurses running all over, everyone dressed up, in hazmat suits like it was a chemical spill, and it's like, was this a good decision or not? But I just kind of wanted to see, is it really as bad as it shows on TV? And yes, it was. It's real. You don't want it, but as we're finding out as testing goes along, a lot more people have it that are asymptomatic. We tend to be a little bit healthier population out here. We're a little more active. We get health care probably a little bit more regularly. We don't have quite some of the undiagnosed underlying, but then we're kind of blessed. We're not living on top of each other. We're not taking 2 train rides into work every day. We live in an apartment or a home with our family. One of the patients I'd had, we had actually 3 rooms next to each other. They were all 3 brothers from the same house. They kind of lived, and all 3 of them passed away. And I think by the time it was done, I think they had 7 family members pass away. But, it was a multi-generational family all sharing, a 3 or 4 bedroom house, which we don't quite get that out here in Delta as much. Not saying there aren't any, because you never say never, but some of our living conditions are a little bit different. Now, the ones that get it, it is horrific. There is only so much that medicine can do. We're still trying to figure out best treatments. Everyone initially was getting the Plaquenil, the zinc, the vitamin C. Did it help? I'm not sure. It didn't seem to help any of the ones I had, but I know people are getting better on med-surg and going home every day. Was it helping them? Possibly. They were going to the convalescent plasma when I was done. That was so people who had already recovered had antibodies in their system. They were basically, it's like donating blood, but they spin it, take the plasma with the antibodies out, return the blood, and then they were giving that plasma to patients currently hospitalized. I wasn't there long enough, so you could say, because they'd only been doing that 3 or 4 weeks by the time I had left. I'm not sure if that was working or not. Some people said yes, some said no. It's just you're going in the dark because we've never seen anything like this before, and there's no set treatment. You know, we kind of do some of it just the way we live. You know, we tend to drive in one vehicle. We live a little further apart. The biggest thing is just washing your hands. Don't be coughing without, you know, either a mask on or covering your face, and then washing your hands. And then just trying to protect those that are most vulnerable. You know, a lot of them that had passed away were the nursing home patients. They were advanced in age. You know, a lot of times that virus would get into one of the nursing homes there in New York, and, you know, it was like a hot knife through butter. It just did not do well to people that had multiple chronic underlying conditions. Yeah, it does, because, you know, there's those that run from a fire and those that run to it, and we're part of the group that runs to it. You know, we know there's patients are sick and what they have might kill us, but we still have a job to do, and we're going to do it.